get started once everyone in the waiting room has been able to join. And thank you, Dr. Delco, for joining us while you're on clinics, which is always a bit of a gamble, right?
Oh, yeah.
That kind of looks like those glucose bottles you hang for cows.
Oh, I was worried it was going to look like a beer. It's
Oh no, maybe that's where other people's minds went. Mine went to glucose
Happy
for some
hour.
reason. Yeah.
Like turning it around. It's
Well, I just give it one more minute till 6:05 and then we can get started. I think Dr. Perkins has a few words, and then typically we save the questions for the end unless there's some kind of question that seems to indicate that there's confusion. And we'll, Sarah and I will monitor the chat and the Q&A and just kind of let you know. And yeah. And for all the attendees, this is being recorded. So if you can't attend the whole time, you're welcome to watch it on our playlist. So that'll be up usually within a few days on our YouTube playlist.
This is also our last seminar of the spring session. So we'll be taking a break for July and August, and we'll start back up in September with a fresh new lineup of more Cornell Equine Seminars.
Okay, it looks like everyone was admitted from the waiting room. So Dr. Perkins, if you'd like to get us started.
Yeah, great.
Looks like we're ready.
Yeah, welcome everyone. We're happy to have you here this evening, and it's my great honor to introduce Dr. Michelle Delco for her presentation today. Dr. Delco has graduated from Cornell Veterinary School and did an internship at the Rood and Riddle Equine Hospital and a residency at UC Davis. And after that time, she worked quite a few years in general equine practice, and then also at another university, which I think I'm going to space on this. Was it Kansas, Michelle? Yeah. Okay, good. And so Michelle really comes to the Cornell Hospital with a lot of clinical experience, both on the road and all these different schools that she's worked at. So she's a great asset to our team. We really love having her here. And we've asked each of our people to kind of say how they're involved in the horse community currently, or how you became involved in horses. So if you could just do a quick one on that, Michelle, and then move on to your great talk this evening, that would be wonderful. Thanks.
sure. So the question is, how am I involved in the?
Yeah, and or some of us got too busy and we're just working as veterinarians, but how do we kind of get into this thing?
Oh yeah, sure.
Yeah.
I grew up in downstate New York, a town called Mamaroneck, New York, and I started riding when I was really tiny, just in the woods, and got hooked right away. And through my whole young life, I worked in barns and mucked stalls when I was little and braided horses for shows, and trained young horses and worked for trainers and worked with a lot of young troubled horses and sale horses. So I grew up riding horses, and they were kind of what made me who I am. And so I owe a lot to them.
Yeah, excellent. And whenever I introduce Dr. Delco, I always have to forget a few things because her history is quite long. But Dr. Delco also did her research here and has a Ph.D. And most of your projects currently focus on orthopedic issues, specifically joint problems, correct, Dr. Delco? Yep.
Yes, exactly.
All right. So, and now I'll let you move on and tell your stories, but thanks everybody for being here tonight, and don't forget us next fall too.
Okay, so I will share my screen. So are you all seeing the correct?
Mhm.
Oh, my advancing button is very touchy, so sorry if I'm skipping around a bit. So today I'll be talking about 5 tips for keeping your horse sound. And I just love some of these old videos, like some of the first movies of horses in motion. So people have been really fascinated by the way horses move and their gait for a long time. And I know even as a young person, I was very interested in this. So my tip number 1, and I should start by saying this is highly curated list. This is definitely a list from the perspective of somebody who sees lame horses every day, right? So this is definitely my take on this. And I'm really happy if anyone wants to sort of jump in and interrupt me, but I'll hopefully leave plenty of time at the end for questions. So tip number 1, start off on the right foot, and I'll be talking about the value of a pre-purchase exam. So this is my house that I bought in 2012 when I moved back to Ithaca, and it's just so charming, and I fell in love with it when I first saw it, and it just has so much heart, and it was built in 1830, and look at how beautiful that wisteria is. But when you look a little closer, when you look a little closer, you can see that the paint is actually peeling and the columns are kind of rotted and the front porch is falling apart, and that is just the outside. That's not even the inside. So luckily my husband was a general contractor before we moved back here. And so we knew this house was a project. So this is him sort of having to rip off all of the siding, and underneath that he found more rot. And anyway, you get the point. The column is taken down on the front porch. We had to totally rebuild the front porch. The point is, you wouldn't buy a house, especially an old house, without an inspection, or most people wouldn't. And if you went in and made this big of an investment without an expert sort of looking under the hood, if you will, I personally would be a little nervous. And so that's what we're talking about. No horse is perfect, as we all know. A pre-purchase exam allows you to make an informed decision. It's not saying you shouldn't buy a horse with a problem, because they all have problems, but you should know what you're getting into. It also allows you to minimize your risk for the future. The risk to yourself, maybe your kids, everybody that's around the horse, and also your pocketbook. It allows you to identify potential problems, even things that are lying under the surface that might not be a problem right now, but folks like I have a lot of experience about which things that we find are likely to be a problem down the road. We establish a baseline where, if this is going to become your horse, what do we see today? And that way, if things change, we know where we started. And then a lot of horses are bought with the idea of an investment. And in fact, my husband and I bought our house with the idea that we were going to keep it for a time and fix it up and then sell it for hopefully a profit. And so, of course, then we got very attached to our house once we invested all the time and love and energy into it. And same might be for horses. So something people don't necessarily think about is by knowing what issues the horse that you're looking at has, it doesn't necessarily mean that will cause you not to purchase that horse. But it may allow you to negotiate the price. And again, that's part of knowing what you're getting into and feeling informed and you're happy with how everything went. So I hesitate to move my mouse because it tends to advance my slides. But someone very wise once said, free horses are sometimes the most expensive horses to keep. And so this is my example of the cost benefit of a pre-purchase exam. So these images I got permission to share. This is when I was just finished my residency. I got a job, a clinical track professorship at Kansas State. So I was doing lots of clinics, and there was a mounted color guard essentially based at Fort Riley, which was right near Kansas State. And really great addition to the community. And these horses, there was a whole program around these horses, and the young men and women that got involved with these horses really learned a lot and had a fantastic experience. All of these horses were free. They did not pay for any of the horses, but every single horse that they considered taking on into their program, they brought to the university and had a full pre-purchase exam, because they understood that horses are commitments, right? And you don't want to bring a horse into your barn, into your life, into your family without, frankly, knowing what problems you're likely to run into. So let's just talk a little bit more about what a pre-purchase exam is. It is a fact-finding mission. So I think of my job as an investigator, right? I'm going to uncover a bunch of information, and then we're going to process that information together. A pre-purchase is performed for the buyer. If you are looking at a horse, you buy that pre-purchase exam, and it is your property. It does not belong to the seller. It's good business. It's also just a snapshot in time. What does the horse look like today? Not what did the horse look like yesterday, or what will the horse look like tomorrow? So obviously there are limitations. And I think that a pre-purchase exam is appropriate for any horse that you expect to do a job. I would say even if you don't expect a horse to do a job, a minimal pre-purchase exam is probably a good idea, just to know what that horse is going to need and what type of management and care is going to be optimal. So pre-purchase is not, I don't administer pass-fails to pre-purchase exams. Again, I take in as much information as I can gather, and then I help you make a decision about what makes sense for you. Again, the pre-purchase exam is not, I am not an agent. I'm not working for the owner. The owner does not own the owner of the horse does not own the exam that's done. And if you're the buyer, you do not need to share the information that we get out of a pre-purchase with the owner if that's not what you want to do. It's not a lameness exam, and we'll talk more about lameness exams later. It's not a guarantee of soundness, and again, it's not only for expensive horses. So during a pre-purchase, many of you have probably been involved in a pre-purchase. We take a history, we do a thorough physical exam, we look in the mouth, we look in the eyes, and importantly, we do a soundness evaluation. And I'll talk more about each of these things a bit more. So we really try to dig as deep as we can. Sometimes we don't have all this information, but I try to do as much due diligence as I can to know as much as I can about this horse. We do a thorough physical exam as you would anytime you bring your horse to a veterinarian. I also pay especially close attention to conformation of their limbs and their feet, their shoeing, the wear of their shoes, because that can give me information that may inform the other parts of the exam and the ultimate decision. So soundness evaluation, we do thorough palpation, we manipulate the limbs, we put hoof testers on, and then walk, trot, lunge in both directions on soft and hard surfaces, and we do flexion tests. So these are just examples of the standard flexion tests. And this is another example of my best friend, Sandy Taylor. She was the my maid of honor in my wedding. This is a horse that she adopted while she was a resident. This is her doing, me as a surgery resident doing a pre-purchase on her horse, and she's doing the flexion exam. So keep in mind that these aren't specific tests for a specific problem. They're just general stresses to see how the horse reacts. So a distal limb flexion exam is when you hold the distal limb flexed for a certain amount of time. And it's really stressing the coffin joint, pastern, and fetlock. So I call it a distal limb flexion, sorry. And then the same with the upper limb and in the front and hind, so non-specific. But they can give us hints about what might be going on and bring subclinical problems to the surface. So what may or may not be involved in a pre-purchase, depending on the discussion that I have with you ahead of time, is radiographs, a written exam, airway endoscopy. So here's an example of a horse with one side of its arytenoid or its airway paralyzed, and that will affect performance at the highest levels. Blood work, so general health, a CBC chemistry, and potentially drug testing. And what we often look for is analgesics and or sedatives. So this goes back to all we have is one snapshot in time. And if the horse has had analgesics, obviously that can cover up our ability to see subtle lamenesses. And then horses sometimes unfortunately have been given long-term sedatives that can affect their demeanor. And that's especially important if you're looking for a child's riding horse. So some of these things obviously are sort of based on what you intend to do with the horse. So if you're buying a horse to be a broodmare or a stallion, then you should definitely consider a breeding soundness exam. And that's not my area of expertise, so I won't talk too much about it. And then some people do request ultrasound exams, but I am of the belief that most times ultrasound exams are difficult to interpret in the absence of lameness, because we can see a lot of artifacts and a lot of questionably significant things on ultrasound. So that can be very difficult to interpret, but certainly there are certain instances where I will do that. So why do we take radiographs? Obviously, we're screening for common problems. And also, if you're considering ever reselling the horse, which likely you will, you would probably like to know if there is something to be seen on those radiographs, even if the horse is sound at the time. A blemish, if you will, on radiographs will probably affect the resale value. And of course, as I said, with ultrasound, especially in a sound horse, it's very difficult to give an interpretation of the significance of the findings that we see, but sometimes we do get a lot of information, and there are certain things that we never like to see on pre-purchase radiographs. So the most common exams we do, sort of in the order of descending commonality, would be front feet, hocks, stifles, and then fetlocks. And again, that is somewhat dependent on the age of the horse and the intended use. So some things we look for in feet, arthritis in the coffin joint, bad angles of their feet, so poor trimming, laminitis. Here's a fragment that I found on a pre-purchase exam in a currently sound horse, and that's definitely not something you want to have involvement with. And then, of course, navicular changes in the feet. In the hocks, it's not uncommon, as we know, for horses to have arthritis in their lower hock joints, and that isn't necessarily a no-go, but it is important if a horse does have changes in their joints know if this is going to be an ongoing management issue for you. Here's an example of an OCD lesion, osteochondrosis lesion, that may very well be subclinical. So the horse may not be lame. It may not have a fusion in that joint, but it's highly likely that this will at some point break off and shed debris into the joint and become a big problem and require surgery. And then, of course, Stifles. Here's another example of an OCD. And then a very subtle lesion that's not uncommon to see on pre-purchase films, just a dimple on the condyle of their stifle. And so there's a little bit of disagreement about the significance of this, but they're all good things to know about ahead of time. And then, of course, Dr. Perkins can speak a lot more intelligently about neurologic evaluations. She's a medicine clinician. But certainly during a pre-purchase evaluation, I always put the horse through its paces just to make sure we feel like they know where their feet are in space. And so here's an example of a young horse that did not know where his feet were in space. He had a faulty connection between his brain and the nerves that run to his limbs that tell himself where his feet are. And so that's obviously a problem in any horse. Horses and riding horses are dangerous enough. In my opinion, no horse with neurologic deficits are appropriate as riding horses. And so just want to, we usually don't do a full neurologic evaluation, but I certainly push them to see if they make mistakes. Okay, so moving on to just checking in on the time. My second tip is get the feel of your horse. And by that, I mean make palpation part of your routine. And so here's a beautiful example. This is way back from when I was a surgery resident. And so that was in the early 2000s. And this client came in. She is quite a new horse owner, but she really loved riding and was getting into the discipline of endurance riding, which was very common in California. And she had this wonderful little horse, and she really, coming into horsemanship later in life, she took it very seriously, and she wanted to learn as much as she could about keeping her horse healthy. And part of her routine was feeling the horse's legs every day when she groomed it. And one day she noticed this swelling. This is the horse's knee. This is the front of the knee, and here's that bump on the back of the knee. And she noticed this swelling right here, and that's a swelling in the horse's carpal canal. She could not feel the horse lame. She didn't know that there was a problem. She didn't know what this was, but she was so familiar with this horse's, the feel of her horse's legs. She knew right away that this was a problem. And I guess I would say, especially endurance riders, event riders, know this and, practice this definitely. So I think everybody should really make this part of their horsemanship. I think learning anatomy is very fun. I am a surgeon, and so from the time I was a kid, I was just enthralled with horse anatomy. These are some drawings from Leonardo da Vinci, and he was also very interested in like the proportions and the muscle groups, and I was also an artist, so I just wanted to know everything about horse anatomy. But there are some really wonderful like coloring books and workbooks that are fantastic if you're just fascinated with the beauty of horses. They also make these beautiful posters, laminated posters that you can hang up in the barn. Really great to have around. But I just want to say that knowing the anatomy, if that's not your thing, if you're not into it, if it just seems too overwhelming, is not a requirement. For example, that client that I talked about earlier, she wasn't quite sure what was going on. She didn't know what she was feeling, but she knew it was different. And I think that's the big thing. Heat, swelling, pain, puffiness. It's amazing how much you can find if you're looking. And so again, I just encourage people, as they're tacking up their horses, they're grooming them, they're bathing them, it's a perfect chance just to sort of run your hands down their legs. And I'll just give you some, hit the highlights, feel the bones, the joints, and the tendons. Try to do it the same every time if you can, just to get into routine, and do it as often as you can. So here, just run your hands down the horse's neck. You can gently feel their withers, straight down their shoulder, blade to the point of their shoulder. This is their elbow. You can just kind of feel there and see what's going on. You see, this is a resident of mine in the past. He's now an owner at Rudenriddle down in Florida. So this was quite a lot of years ago. This is when he was a resident. And so these are the flexor tendons on the back of the leg, and you just want to palpate straight down those, and then feel the feet for sure. And you can also feel the back of the fetlock and feel for pulses right around the back of the fetlock on the inside and outside. And I put this picture in there because even if your horse has a scratch or a scrape or something that we know is wrong, you will see us go ahead and feel the whole horse's leg, hopefully, just to make sure that whenever they did this injury, this scratch on their leg, they didn't do something worse, because Murphy's Law and horses dictates that they've likely gotten into more trouble than you know. So on to tip number 3. Never underestimate a limb wound. No matter how innocent it looks. Some of the biggest disasters that I've dealt with in my career have been seemingly benign wounds on a leg. Oh, sorry, can't use my pointer. So why? Obviously, here's a picture of a horse that has scraped its knee and is losing blood, but this looks like a lot, but for a horse, this is not a lot of blood. So usually we're not talking about blood loss as a major problem, but that certainly can be an issue, especially if they're turned out and it's not immediately apparent. They've been moving around and it's not all in one place, and you're not sure how much they've lost. Again, they can certainly injure their stabilizing or supporting tendons and ligaments. And this is just an example of a laceration to their superficial flexor tendon, their deep flexor tendon, and then their suspensory. And you would notice that they can't support their weight on that leg. But again, this would be obvious. And I think everybody, if they have a big laceration at the back of their leg, would certainly call the veterinarian. But I wanted to give a couple examples of maybe less obvious problems that turn into big problems. So one would be a contamination, so an injury that involves a joint or tendon sheath. And sometimes it's difficult to tell where the limits of those structures are. So this is an example of a broodmare. She's a very, very nice, well-bred, thoroughbred mare that was, I believe she was 8 months pregnant with a very nice, a foal to a very nice stallion. And she presented because she'd been out at pasture, and they noticed this small wound that was sort of on her forearm, which generally speaking, forearm, not a bad place to get a wound. It seems quite far away from the horse's elbow. Its shoulder's way up here, its elbow's way up here. But it was a chronic draining wound. And she wasn't very lame, but she was a bit lame. And so on closer inspection, the wound was dripping some of this yellow sticky fluid. And unfortunately, when we did some x-rays of this elbow joint, that wound, which was out of the picture way down here, in fact communicated with her elbow joint. And she'd probably been dripping synovial fluid for quite a long time and had very, very severe arthritis in that joint. And that unfortunately was not a problem that we could solve for her. And we weren't able to get her through to foaling once this was discovered. So she obviously had some kind of penetrating wound that went up and under the skin and sort of went up into her elbow joint. So then another not uncommon thing I see are horses that come in from pasture and maybe have a swelling and maybe a tiny, tiny little draining tract, and they may or may not be lame, but then their draining tract doesn't heal, or they become more lame, or they present to me for evaluation. And here is a BB placed over a draining tract that had been draining for about 3 weeks in this horse. He had apparently gotten kicked out at pasture, and you can see this long spiraling fracture of his cannon bone, non-displaced fracture. Whoa. And this is the horse. He spent about 5 months in the hospital in a full limb cast in a sling, healing that fracture. And so he was not as lame as you would have expected him to be with this non-displaced fracture, but it's a great thing we found that when we did, because the bone in a hairline crack starts to resorb around the crack, and in about 2 to 3 weeks, the bone is at its weakest point. And it's often then when a horse will step wrong or twist and then have a more catastrophic fracture. And here's just another example of a chronic draining wound in a young Clydesdale, actually. And here you can see he got kicked in the radius, and he has this already remodeling fracture of his radius. And he stayed on stall rest as well and healed this just fine. But we knew he needed stall rest. He couldn't be turned out. So why, getting back to joint infections, why are they so big of an emergency? Well, unlike infections other places, for example, in muscle tissue, bacteria really get down into joints and tendon sheaths. They don't have great blood supply, and the bacteria sort of set up shop, take hold in the lining of that joint structure, and they just can really become incurable infections. And so that causes arthritis, so it breaks down the cartilage inside that joint over time. You end up with chronic lameness on one limb, and the opposite supporting limb is almost certain to become laminitic after a short time, or sometimes even months or years. And so horses can't live with chronically infected synovial structures. And we have to be really, really sort of aggressive about treating these. Antibiotics alone is not sufficient to clear infections. We have to get really high levels of systemic antibiotics and regional antibiotics. And this picture shows what we call a regional limb perfusion, where we put a tourniquet above the joint and then put antibiotic concentrated into the vein, and then it perfuses all the tissues. And these are surgical emergencies. And so the quicker we can get to the contaminated joint, the better chances we have of clearing that infection before there's lasting consequences in terms of the horse's long-term soundness. So in this category of limb wounds, I also add penetrating wounds of the sole. So what a lot of people call street nail. And here in this picture, you can see this horse with a nail stuck in its frog. And this is a very small, busy picture, but I just wanted to show you all of the many critical structures that are within a nail's distance, nail's length away from the bottom of the foot. And any of these structures being infected can be life-threatening. And so here's just some x-rays. Here's a nail in a foot. Looks like it's not too close to anything important, except this is its navicular bursa. And so that nail did contaminate the navicular bursa, and this is a very, very serious life-threatening problem. Maybe less life-threatening because it's not sort of the same way incurable, but still requires aggressive treatment, is osteomyelitis, so infection of the bone. We do have to get in there, clean out that dead and infected bone, and treat really aggressively with antibiotics. So just take homes for this especially important tip number 3, a simple wound on a horse's leg or elsewhere should not cause severe lameness. And a wound into a synovial structure is always a life-threatening emergency. And therefore, since it's sometimes really hard to tell if you're close to a joint, might seem really far away, I would say any wound on a horse's limb is potentially a life-threatening emergency. I had given a talk similar to this to a group of folks who were in a driving club. And so I dug out these old pictures when I was in my 20s. I was a vet student. You see my stethoscope on around my neck. I spent summer, it was actually after my second year in vet school, in the Netherlands at the vet school there. And they asked me to examine horses at this driving event. And this is me with this team of ponies that I unfortunately disqualified from the driving event. Okay, so on to tip number 4. How are we doing for time? We're doing great. So tip number 4 is get to the bottom of the problem. And here I'll be talking about the value of an actual diagnosis. And by that, I mean a full lameness exam. So sometimes it's not uncommon for talking to owners and asking them about their horse's problem. I'll say, well, has your horse been lame? And they say, no, my horse has not been lame, but he's just a little bit off. And so I think lameness has a bad rep. Nobody wants their horse to be lame. But anytime your horse is not responding as you expect it to, is refusing to do the job that they've done happily for a long time, there are always many explanations for that, behavioral, medical, and otherwise. But more times than not in my world, horses are lame. And of course, I see many lame horses. So why do we need to do a full orthopedic exam and lameness exam? Because different problems have different solutions. That seems silly to say, but sort of like saying my horse colicked. Colic is a symptom that can be caused by a lot of things. So when your horse colics, the veterinarian comes and tries to figure out what's underlying the abdominal pain that they're experiencing, right? It's the same thing with lameness. We really have to get to a diagnosis to understand how to treat the specific problem appropriately. And timely and accurate diagnoses let us treat the horse correctly and give it the best chance of future soundness. So we consider in my line of work that chronic problems almost always have a worse prognosis than if you get to a problem in its acute phases. And that's because if you have inappropriate healing of an injury, and now I'm especially talking about soft tissue injuries in horses, though they tend to re-injure those soft tissue injuries. So they're very prone to re-injuring the same spot or adjacent. And things like joints tend to undergo degenerative change after injury. And often by the time we recognize osteoarthritis, for example, in a joint, those changes are irreversible. So better to have the horse evaluated and come to a diagnosis right off the bat so that we can cut off that degenerative process before it becomes end stage disease. So this is just another way of saying it allows us to address issues proactively. There was a study a while back that found that horses, and this study was looking at race horses specifically, presenting for poor performance were most often 3 out of 4 times lame. So this is a population of horses that are evaluated by grooms and veterinarians almost on a daily basis. I mean, definitely grooms and certainly veterinarians on nearly a daily basis when they're on the racetrack. And they're very keenly aware of lameness and they look for it. And still, by the time horses are referred for poor performance, assuming it's not a musculoskeletal problem, still 3 out of 4 times those horses were lame. And it just took really, really a deep investigation to make that come to the surface. And it's really important to remind ourselves that a lot of horses compete exceptionally well with mild lameness issues. And the longer they do that, the harder it's going to be to ultimately heal whatever injury they've been grinning and bearing. Ooh. Sorry. So Lameness exam is a lot like our pre-purchase exam, so I won't go over all this again, but the question that we're trying to answer is your horse lame today, and are we able to figure out where that pain is coming from? And that's called lameness localization. If you turn your ankle and you go to your doctor, he'll refer you to an orthopedist and they'll say, why are you coming in today? And you'll say, my ankle's really sore, I turned it. Horses, we recognize them as lame when their gait isn't quite right. You know, they're asymmetrical. They don't feel right when being ridden, but there's no way to know where in the leg that pain is originating from. Sometimes they've got heat or swelling that gives us a hint. But if I had a dollar for every time I examined a horse and found something that drew my attention to a particular joint, but it was a red herring, I would be a rich woman. So horses, like I said before, aren't perfect. A lot of them have a swelling, a ding, you know, lots of things to see. The question is, today, where does this horse hurt? Why does this horse show us a gait abnormality? And we do this by blocks. So regionally, we desensitize the horse's leg and try to ferret out where that pain is coming from. And this process seems really horrible. We're sticking needles into the horse, but it really, by doing this process, we can really focus our diagnostic energy and our money to actually come up with a diagnosis. And so many of you probably have had a horse blocked in the past, but this is what happens. So the nerves that bring sensation from the horse's limb up to their brain sort of run up and down the leg. And so what we do is start at the bottom of the foot, and we place a numbing agent over that nerve down low. And if the pain is originating from anywhere below that, then they should improve. They should look more sound. Their gait should be more symmetrical when we block them down low. If they don't look any better after we place the first block, we say, okay, it's probably not in the horse's heel or sole. So then we go up and we block a bit higher. This is called an abaxial block. And it blocks all the structures sort of from the pastern, back of the pastern down, and so on and so forth. And then if they have not improved up to their knee and we can go higher and then they improve, we can say, all right, great. We made a change in the way the horse looks. The problem is somewhere in this forearm area. And so therefore, we can prioritize what comes next. Do we take x-rays? Do we do an ultrasound? And so we can really focus our attention on the area that is a problem. Oftentimes we can also, if, for example, a horse has some extra fluid in a joint and flexes positive to that joint, we can go ahead and put block into the specific joint and then see if that intra-articular block improves the horse, and so on and so forth. So those are the two sort of modes that we use to sleuth out where the pain's coming from. And then once we know where to focus, then based on the entire picture, we can decide ultrasound first, soft tissue imaging. Do we need to take x-rays first? Usually one or both of these things are first. And then if we find nothing or we get a hint about what's going on, but we need more information, we can talk about and consider the other sort of more advanced imaging. And then hopefully that will give us a diagnosis. So what is actually the problem? And then we can come up with the appropriate plan, and that appropriate plan is really tailored to the specific injury. You know, before we had MRI and we could look through the hoof capsule into the soft tissues in the foot, if a horse blocked, you know, their pain originated from the foot, we'd call it navicular disease, you know, because we could see maybe some changes on x-ray. But now we know so commonly that horses that have some, you know, changes on their x-rays and their navicular bone very, very commonly, more importantly, have soft tissue injuries in one of a dozen or so structures in their foot that all have different treatments, right? So this is the value of a diagnosis, is that we can act on those things quickly and treat them appropriately. And those treatments can be very different. We may suggest an anti-inflammatory like a steroid injection. It may be joint preservation strategies like, you know, some of the Adequan Legend, those types of products. May need to take a chip of bone out of the joint to prevent further damage. You know, knowing that that's going to speed up the degeneration or the breakdown of that joint. And so then we can decide if the horse does need surgery. And okay, I'm going to try to finish up here quickly so I leave plenty of time for questions. This tip, I'm not going to spend too much time on because this is not my area of expertise, but I think it's really important. And this tip is really consider working with somebody who is an expert in general and discipline specific conditioning of your equine athlete. So general conditioning is what I'm basically going to talk about, but I would encourage you to also work with a trainer or inform yourself about what rigors each sport puts on your horse and what are some really good conditioning for that specific discipline to strengthen your horse's musculoskeletal system in the appropriate way. So here's that image we saw at the beginning of the talk. And again, like this is a galloping, flat racing, thoroughbred horse. And one might think that the best exercise to train this horse for its job is galloping. But it turns out that's not true. So I did some research when I was an undergraduate here at Cornell, and I worked in a biomechanics lab up at the vet school up here. And the researcher that I worked with wanted to figure out how the horse's leg worked, the forelimb of the horse worked. And so it turns out that horses are evolved to be trotters. Their musculoskeletal system has evolved over the millennia to trot and walk long distances very often. And what we found out is that horses' legs are like springs. So these flexor tendons at the back of the horse's leg are actually attached to muscles on top. And those muscles attach to bone. So when a horse trots, it loads this rubber band, essentially, or spring. And when the leg comes off the ground, they recover that energy that they loaded into that spring, and it makes their gait more efficient, right? So this tells you that the muscles are really important in protecting horses' legs from soft tissue injuries of the flexor tendons. So if horses are not conditioned properly at a trot, these muscles will fatigue. And once these muscles fatigue, it allows these tendons down lower in the leg to be injured. And so you can think of a horse's leg as a pogo stick. This guy can jump over this jump because he's loading his weight into the spring inside that pogo stick. But if you overload it, they do break. And so going back to that sort of video in the beginning, you know, horses at a gallop have this huge suspension phase where all four limbs are off the ground. And when they are bearing weight on a single leg, they have all the weight of themselves and their rider pushing down on that suspensory apparatus. So you can see how important conditioning is to those muscles that attach to those tendons. And here's just another picture of me at the vet check in Netherlands when I was in my 20s. So in summary, consider a pre-purchase exam. Make palpation part of your routine. Always beware of limb wounds and assume the worst, hope for the best. Invest in a diagnosis if there is a problem, even if you think it's very subtle. Better to know sooner rather than later. And then really the corollary to conditioning in my world is investing in a diagnosis allows us to determine what is the appropriate rehabilitation for some of these soft tissue injuries that when left untreated and become chronic can be really, really tough to get them back to soundness. So that's all I have. And thank you so much for tuning in. And I'd be really happy to take any questions.
Thank you so much, Dr. Delco. And for those attending, you can enter questions in the Q&A box or in the chat, and the panelists will see them. In the meantime, there were a few pre-submitted questions, Dr. Delco, so I think I'll start. Some of them you've answered already, so I can skip those, but this maybe is a bit of a loaded question, but someone's asking whether supplementation for joint health works.
That's I give a lecture on treating joint disease in horses, and I have a whole slide in my lecture, and I say the most common question I get as a lameness veterinarian and equine surgeon is what supplements should I use on my horse, and do they work? And so what I can tell you is that the short answer is we're not sure if they'll help, but they probably won't hurt. There are very, very few studies in veterinary medicine looking at the true efficacy of these things. In human medicine, they have a lot more studies. So they have hundreds of thousands of people that have been treated with all sorts of these products, right? They can conglomerate like many, many people in many studies and look what they call a meta-analysis. So look over many studies. And even in human medicine, there still is no solid evidence that any joint supplements actually make a difference in terms of slowing down joint disease or preventing arthritis or helping. Having said all that, anecdotally, I think that supplements definitely help some horses. And I certainly use some of the injectable supplements after surgery when we want to quiet down inflammation in joints and support the lubrication of joints. The big problem with horses is that most of what you feed them gets digested by the bugs in their gut. And so there's no requirement that these companies show that these things are even absorbed, into their bloodstream, let alone get to the joints and things like that. So I would say it certainly won't hurt. If you're going to use a supplement, investigate the ones that have great reputations, and have done some testing to ensure that what they say is on the label is on the label. But I would say if you are going to choose between buying a very expensive bucket of supplement or taking your horse and getting a full evaluation and making a diagnosis, which do I think is a better investment? Obviously, I think that knowing what's wrong is way better. So maybe that was too political
Well
of an
said.
answer.
No.
But
as vets, we always want a diagnosis first, right? Yeah. There's an interesting question in the chat. Maybe I'll switch back and forth between the pre-submitted ones. They're kind of wondering, so for PPEs, you mentioned drug screening. They're wondering how kind of foolproof or inclusive those are, or if you have to be very specific in what you're looking at.
Oh, wow. That is probably a question that Dr. Perkins can answer a little bit better, but I have a little bit of knowledge around this. We get better and better at testing for different substances, and the cheaters are always going to cheat and find different ways to cheat, and so it's not foolproof, but for detecting the big, common stuff that is ubiquitous, it's pretty darn good. And it does, I've had many horses unfortunately come up positive on drug screens in pre-purchase exams. And there's just something, that we need to know. And sometimes I guess I would say that you don't necessarily need to submit the drug screen, but often I was asked or suggested that we pull blood for a drug screen, save it in the fridge, wait, if the horse all of a sudden is bouncing off the walls and is, super hyper, a month after the horse gets purchased, at least we have that option. So I don't know. I think Dr. Perkins might have more information about that than me.
Actually, it's been a while since I submitted a kind of tox screen for that, but they do kind of test for like the buttes and the banamines and the common stuff that people are using. If you're really doing tox screens and kind of want what's everything in the world, then those become quite expensive tests as well. Yeah. And I do think that sometimes if you have an agreement with the buyer, if you are trying the horse for like a month to see what kind of fit you are with that horse, that can be helpful as well. Because if the horse is in your care for the kind of 2 weeks to a month, then there really shouldn't be drugs that are still sort of acting on that horse's mentation and calmness and all those kind of things. So yep.
And sometimes it's enough to let the buyer know you'll be drawing some blood at the pre-purchase. That often works. Yeah. So we have another question, more of a general question. They have a mare who was recently diagnosed with a splint bone fracture, and it's a little bit adhered to the suspensory, and she's, I think, just kind of looking for what's ahead and, maybe prognosis and treatment course.
Yeah. So splint bone fractures can run the gamut. Sometimes a horse can fracture their splint bone and it can heal without a problem. Horses can fracture their splint bone and immediately be lame and need that fragment removed. Horses can fracture their splint bone, be okay for a time, but then the leg starts to swell up and opens up and drains. And that usually means that the piece of bone that broke off lost its blood supply and the body's trying to get rid of it like it would a splinter. So then that needs to come out. The situation we're talking about here is honestly the most common reason I do surgery on horses that have had in the past splint bone fractures, and they seem to heal without a problem. But it can be that over time they develop an adhesion between that callus tissue, that scarring tissue, healing tissue, and the ligament that sits right next to it. And so it can be a bit tricky to sort of make a real prove to ourselves that is truly the problem. But there are several things we can do. We can block the area, desensitize it, like I talked about. We can also ultrasound it. And if we can actually see the attachment, that adhesion, that's usually a pretty good piece of information, along with the horse being lame, that we need to do surgery and get that out of there so it doesn't further irritate the suspensory. And so I hope that if there's more specific questions other than what I've already answered, just feel free to type it in the chat.
Awesome, thank you. And then a really good question in the chat that I think would be good for everyone to kind of hear your answer to. I think they're worried. So a horse has a chronic leg problem and the owner is wondering if they have to worry about the contralateral limb or the other side.
Yes. Is the short answer, for sure.
Right. Never forget, right? The other side.
Usually for a horse to founder, so to have laminitis because of overweight bearing, so they're stressing by overweight bearing on one leg, they're doing damage to the attachment between their coffin bone and the hoof wall. And that's what causes laminitis, that attachment between the hoof wall and the bone in their foot is broken down, and that can be devastating and life-threatening. So that usually requires a pretty severe lameness. So a horse that you can see is lame at the walk is kind of the way to think about it. It's a little oversimplification, but any horse that's lame enough to see it at the walk is certainly over time at risk for chronic laminitis. That's why horses can't be non-weight bearing lame on one limb because they pretty quickly will founder on the other. And so it kind of depends on what the reason for the lameness is and how long and how severe, but yeah, that's kind of my message to you.
Yeah, I thought that might be a good one for everyone to hear. Yeah, never forget the other side, right?
Yeah.
And then there's another question, maybe time for one or two more questions. I thought was interesting, a little broader than supplements, just nutrition more generally speaking. She's saying that she has a young mare who she rescued from a kill pen, and so kind of an unknown history. And she was pulling a shoe pretty much every cycle until they started using glue-ons. Is it possible that early poor nutrition can contribute to a problem like that?
Yes, but honestly, more commonly, the reason for poor footing is for poor hoof quality is usually genetics. A perfect example of that is thoroughbred racehorses, right? They've been bred over the years to be faster and faster, and with that, their hoof wall has become thinner and thinner and more brittle. And so, if you have, adopted an off-the-track thoroughbred, the joke is, they have the worst feet in the business. I had a friend when I worked down in Kentucky, Lexington, Kentucky, whose husband or partner at the time was a farrier at one of the broodmare farms. And he said he can almost age thoroughbred broodmares by the thickness of their hoof walls because so quickly, they really have lost their feet. So often it's genetic. And so that's usually a problem. There are supplements and there are certainly things that we can adjust about their nutrition to try to help them build better feet. And though I think good farriery, even if you don't want to put shoes on the horse, having them trimmed regularly, often horses with bad quality feet really can't go very well without shoes, unfortunately, just because their feet don't stand for it. In the Northwest, where I worked for many years, it was just so muddy and the horses' feet were wet all the time. And so that's another consideration is if you have a horse with really poor quality feet, you just have to be especially conscious of their housing and their management, right? To let their feet dry out.
Awesome, thank you. What do you think? One more question, or should we? We're pushing it a little late. Maybe a nice broad one at the end. Someone's just asking in the chat, how do you know, like, basically when to start working horses? That maybe is a good lameness prevention tip in terms of what age.
Yeah, this is also a really tough question, right? Because, racehorses get started really early. And as 2-year-olds, they're already in full work. Usually disciplines like sport horse disciplines wait a lot longer. I think larger breed horses to some extent do mature a bit slower. I know that that's kind of a broad statement, but I think that the bigger bodied horses certainly need more time to sort of let their joints and their growth plates and their brains mature a little bit for what you're asking them to do. And so I'm not going to give you a specific age, but I broke a lot of young horses when I was a kid and have the scars to prove it. No. But we started groundwork with very young horses, so foals, just getting them used to humans. And as their mind progressed, we did more groundwork and getting them used to saddles and stuff, so that by the time they were sort of in their 3rd year, we started doing light light work, but it's very discipline specific, and the methods that you use and how slowly you go or quickly you go. You know, in thoroughbred racehorses, they basically put a saddle on and toss somebody on, you know. So anyway, I know that's not a good answer, but
no, it's a very hard one. And I think it's good to hear sometimes the experts let you know it's okay that there's no one good answer sometimes, right?
yeah, I will say, I guess I can give a bit more sort of scientific answer in that there are certain growth plates in the horse that don't close before, you know, a horse is almost 2 years old. So that's an important piece of information to have.
Sure. Yeah, definitely. Awesome. Well, thank you so much. We didn't get to everything, but I think we're pushing it a little late here. So thank you very much. And I know Sarah put in the chat that, yeah, that remember we're taking a break, but we'll start again in September. So we'll just have July and August off here, and we're going to have a lineup, a pretty cool lineup next semester. So you can register in the same place as you did before. And I don't know if Jillian or Sarah want to say anything in addition.
No, I'll just say thanks to Dr. Delco for a great talk this evening, and lots of good pearls of wisdom. And it's been a great year. Thanks to Sarah Bassman and Lindsay Goodale for organizing all this and keeping up on all the details. And like Sarah said, you can put in some requests for different topics you'd like us to cover in the future, and that they are registrants are able to kind of find these talks online and view them at other times. So yeah, so thanks everybody for being here, and ride your horses and have fun this summer. Huh?
Absolutely. Thank you all for attending, and we will send you a link to this video recording with some additional resources in a few days. So thanks everyone. Thanks, Dr. Delco. Really great talk.
Thank you very much. Bye guys.
Bye.